Ever catch yourself wondering whether the way you take care of your own body, especially the way you touch yourself, still matches what you truly need now that you're over 60? Hey, that question is more common than you think. A lot of men quietly wonder the same thing. And it's not just, is it okay? It's, how do I do this in a way that actually supports my body, my energy, and my health? You're not alone. And there's nothing strange or shameful about wanting to understand your body better, especially as it changes. I've got you. Let's walk through it together, one step at a time. I'm Dr. Ava, and for a lot of years, I've walked side by side with thousands of men, helping them stay connected to their bodies, stay confident in their sexuality, and move through aging with strength and dignity. You're not navigating this alone. This is what I do, and I'm here to guide you with clarity and respect. Before we even get into today's topic, I want to hear from you. Tell me in the comments where you're watching from. And while you're there, tap that like button and subscribe. Not for me, but because it helps more men get access to honest, reliable health guidance that they're not getting anywhere else. Now, let's talk about something most men never discuss, but absolutely should. How to take care of yourself sexually after 60. Specifically, how to masturbate safely and the 3 major mistakes you really want to avoid. First, let's clear some space and breathe. Masturbation isn't dirty, it isn't shameful, and it definitely isn't something you grow out of. It's normal, it's healthy, and as you age, it can actually become more important for your circulation, your hormones, and your emotional well-being. A lot of men in their 60s, 70s, and even 80s quietly wonder, does my body still need this? Am I doing any harm? Those questions are real, and they're valid. But here's the truth. Most of the fear comes from silence, shame, and outdated myths, not from science or reality. So you're not doing anything wrong. You're simply learning what your body needs at this stage of life, and I'm here to guide you through it. Here's the biological truth, and I want you to really let this sink in. Regular, gentle self-stimulation does a lot more than most men realize. It keeps healthy blood flow moving through the penis, maintains the integrity of your erectile tissue, supports your prostate, lowers stress hormones like cortisol, and even helps you sleep better by calming your nervous system. And on the emotional side, it keeps you connected to yourself, easing anxiety, grounding your confidence, and preserving that inner sense of vitality and masculinity. But here's the part most men were never taught. Your body doesn't respond the same way it did at 25. That's not failure. That's biology. As you age, the skin gets thinner. Nerves fire a little slower. Blood vessels aren't as elastic as they once were. So the way you approach pleasure has to evolve with you. Think of your body less like a machine you're trying to fix and more like a classic car, something valuable, seasoned, and deserving of patience. With the right touch, presence, and attention, your body can still give you deep relaxation and satisfaction. You've just got to avoid the 3 big mistakes most men slip into without realizing it. And as I mentioned, I'm Dr. Ava. For a lot of years, I've practiced as a urologist specializing in men's health, guiding men from their 30s all the way into their 80s. And over again, I've seen the same pattern. It's rarely the body that limits a man. It's misunderstanding, rushing, or shame. So let's break this down together, step by step. You're in good hands. Here are the 3 biggest mistakes older men make when it comes to masturbation, and what to do instead. Let's take this step by step so you can actually feel the difference in your body. Mistake number 3, rushing through it. A lot of men treat self-pleasure like something they need to get over with quickly, almost like scratching an itch so they can move on. But when you rush, your whole system stays in a stressed state. Your nervous system never shifts into relax and receive mode. Blood vessels stay tight, your heart rate climbs in an anxious way, and your brain starts to associate intimacy with tension instead of safety. The fix: slow everything down. Turn off the noise. Take a few slow breaths and let your body arrive before you even start. When you stop trying to race to the finish line, your sensitivity comes back, sometimes in ways that surprise men who thought they'd lost it for good. Mistake number 2. Using too much pressure. As sensation changes with age, many men try to compensate by gripping tighter and tighter. But the penis isn't designed for force, and too much pressure can cause tiny microtears nerve desensitization, what some call death grip syndrome, trouble responding during partnered intimacy, irritation, and inflammation. And emotionally, this creates a cycle of stronger stimulation but less satisfaction. The fix: ease up, loosen your grip. Use a simple, fragrance-free, water-based lubricant. Treat your hand like you're giving a gentle massage, not squeezing for dear life. Your sensitivity increases when you approach your body with patience instead of pressure. Mistake number 1. Ignoring your emotions. This is the one almost every man overlooks. Many carry quiet shame, maybe from upbringing, past beliefs, or discomfort around getting older. But here's what shame actually does inside your body. Cortisol spikes blood vessels constrict, arousal becomes harder to maintain. Your emotions are not separate from your sexual health. They're connected. The fix: compassion. Remind yourself you're not broken. You're adapting. If the shame feels heavy, talk to a trusted doctor or therapist. Intimacy is part of emotional well-being, and you deserve that. Step-by-step safe practice guide. Create a safe, private space. Clean hands, clean towel. Use lubricant. Start slow and breathe. Use gentle stimulation. Change rhythm occasionally. Pay attention to any pain or irritation. Release the shame. Your body isn't your enemy. Aftercare. Let your body settle before moving on. When you approach your body this way, the whole experience shifts from finishing fast to supporting your health, your confidence, and your peace of mind. Maybe you're thinking, I've been doing this the same way for decades. Is it too late to change anything? Absolutely not. Your body is far more adaptable than you realize. Give it patience, give it gentleness, and it will respond. I see it all the time. Men in their 60s and 70s rediscovering a deeper kind of pleasure simply because they finally slow down, pay attention, and stay present with themselves. You're not past your prime. You're stepping into a stage of mastery, a stage where you understand your body better, treat it better, and receive more from it than you ever did before. I once had a 70-year-old patient who came to me quietly and said, "Dr. Ava, I think my body just doesn't respond anymore." But when we explored his habits, the issue wasn't age, it was rushing and using too much pressure. After adjusting his approach and slowing down, his sensitivity began returning within days. He later smiled and told me, "I didn't realize my body could still feel this good." It wasn't dysfunction. He just needed a new way of caring for himself. If this video brought you any clarity or comfort, go ahead and like, subscribe, and share it with another man who might quietly need this message. You never know who you'll help by doing that. And in the comments, tell me what men's health topic you'd like Dr. Ava to break down next. Your questions shape these videos. Remember this: your age doesn't control your passion, your choices do. Stay steady, stay kind to yourself. And I'll see you in the next video. Cheers!